You know that moment when you are falling asleep? Your body relaxes, and then suddenly your whole body jerks like you are falling off a building? That is not a ghost. That is not you going crazy. That is a sleep glitch. In this video, we are going to talk about the strange, scary, and funny glitches your body does while you are trying to sleep. And unlike most videos, I am not only going to explain what they are, I am also going to tell you what you can actually do about each one. Let's start. This is Sleep Glitches, Part 1. If you have ever had something weird happen while you were asleep, tell me about it in the comments. If enough people mention the same glitch, I will make a whole episode just for that. Now let's begin with glitch number 1. Glitch number 1, Hypnic Jerk. You are drifting off. Your muscles finally relax, and then your brain suddenly hits the panic button, and your whole body jumps like you are falling. That jump is called a hypnic jerk. It happens when your muscles relax faster than your brain expects. Your brain misreads that as you physically falling. So, it sends out an emergency signal to your muscles. The result is that full body jolt that wakes you up. Why does this happen more often sometimes? Stress can make it worse. Too much caffeine makes it worse. Sleep deprivation makes it worse. And sometimes, a weird or uncomfortable sleeping position can trigger it. What can you do about it? Cut off caffeine at least 6 hours before bed. Do a quick 1-minute stretch for your legs and shoulders before you lie down. And try not to stare at your phone right before sleeping. Your nervous system does not enjoy a blast of blue light and chaos right before bed. Your body is not stupid. It is just running on very old safety software. Glitch number 2, sleep onset insomnia. You are tired all day. You cannot wait to go to bed. But the second your head hits the pillow, your brain wakes up and decides to play a highlight reel of every awkward thing you have ever done. This is called sleep onset insomnia. Your nervous system is still in alert mode. Your body is tired, but your brain is on guard. One of the main reasons is the stress hormone cortisol. It hangs around too long and makes your body feel awake even when you want to sleep. What makes this worse? Stress, obviously. Too much screen time before bed. An irregular sleep schedule. And habits of overthinking, like mentally replaying your entire life at 2 a.m. Here is one counterintuitive trick. It is called paradoxical intention. Instead of desperately trying to fall asleep, you tell yourself, stay awake. That lowers the pressure to sleep. When the performance anxiety goes down, your body often relaxes and sleep comes easier. Other things that help. No screens for 30 to 60 minutes before bed. Dim the lights. And try slow breathing. Breathe in for 4 seconds and breathe out for 6 seconds for a few minutes. Your brain is not trying to torture you. It just forgot where the off switch is. Glitch number 3, nocturnal leg cramps. You are peacefully asleep, and then suddenly your calf locks up with a sharp cramp that launches you out of bed. A nocturnal leg cramp happens when the nerves controlling a muscle misfire. The muscle contracts hard and refuses to relax. It can feel like your calf has turned into a rock. Why does this happen? Dehydration is one reason. Low electrolytes can play a role, like low magnesium or potassium. Sitting for long periods during the day can contribute. Overexercising a muscle without stretching it properly can also increase the risk. What can you do? Drink enough water during the day. Get some electrolytes from foods like bananas or from electrolyte drinks if needed. Stretch your calves for 20 seconds or so before bed. Point your toes up gently and feel the stretch in the back of your leg. Sometimes it just means you lost a fight with your own calf muscle. Glitch number 4, Sleep paralysis. You wake up. You can see your room. You can hear everything. You are fully aware. But you cannot move. You cannot speak. It feels like your body has disconnected. Sometimes there is even a shadowy figure in the corner of the room, or a feeling of something sitting on your chest. This is sleep paralysis, and it can be terrifying. Here is what is really happening. During dream sleep, also called REM sleep, your brain deliberately turns off most of your muscle movement. This is meant to keep you from acting out your dreams. In sleep paralysis, your brain wakes up, but your body is still in that locked dream mode. Your mind is online, but movement has not been turned back on yet. Why does it happen? It is more common if you have an irregular sleep schedule. It can be related to stress. It often happens more when you sleep on your back. What can you do? Try sleeping on your side instead of your back. Keep a more consistent sleep and wake time every day, even on weekends. If it happens, remember that it is temporary and will pass. Focus on slow breathing to calm the panic. It is not a demon on your chest. It is your nervous system lagging. Glitch number 5. Exploding head syndrome. You are about to fall asleep. You are relaxed. Then, in your head, you suddenly hear a loud, explosive noise. It might sound like a gunshot, a door slamming, or a crash of thunder. It feels very real, but nobody else hears it. This is called exploding head syndrome. Despite the dramatic name, your head is not actually in danger. What is happening is that some of the auditory parts of your brain misfire as your brain shuts down for sleep. It is like the sound system in your brain glitches as it powers off. Why does it happen more sometimes? Stress can increase the chances. Lack of sleep can make your brain more jumpy. An irregular sleep pattern can also contribute. What can help? Keep a more regular sleep schedule. Try to reduce stress before bed. Avoid stimulants like caffeine or energy drinks late in the day. Your brain is basically turning off the lights and accidentally sets off the alarm on the way out. Glitch number 6. Restless Leg Syndrome. You lie down and try to relax, but your legs suddenly feel like they are buzzing, itchy on the inside, or full of energy. You feel a strong urge to move them. The feeling only gets better if you get up or move around. This is called Restless Leg Syndrome, or RLS. It is a neurological glitch involving dopamine pathways in the brain. The sensation is often described as crawling, electric, or uncomfortable pressure inside the legs. Why does it happen? It can be related to low iron levels. It can be connected to dopamine imbalance. Certain medications can make it worse. Sometimes it runs in families. What can you do? You may want to get your iron levels checked by a doctor. A warm shower or bath before bed can relax your muscles. Light leg massage or stretching can help. Reducing caffeine may improve symptoms for some people. Your body wants to rest, but your legs did not get the memo. Glitch number 7. Catathrenia, also called sleep groaning. Imagine you are sleeping quietly, but your partner hears long, low, strange groaning sounds every time you exhale, almost like a ghostly moan. This is catathrenia. During sleep, you hold your breath for a moment, then slowly exhale with a drawn-out groan or moan. It usually happens in deeper stages of sleep. The exact cause is still not fully known. The good news is that it is usually harmless. The bad news is that it can sound creepy enough to scare the person sleeping next to you. What might help? Improving nasal breathing can sometimes reduce it. Sleeping on your side can help in some people. Practicing calm, Regular breathing exercises before bed may also help. You are okay. You just sound like a haunted house sometimes. Glitch number 8. Sleepwalking. You go to sleep in your bed. Then you wake up somewhere else in the house. Maybe in the kitchen. Maybe standing in the hallway. You might find things moved around with no memory of doing it. This is sleepwalking. It happens during deep, non-REM sleep, when your brain normally should be very relaxed. But in this glitch, the motor system that controls movement partially wakes up, while your conscious awareness stays asleep. Why does sleepwalking happen? It is more likely if you are sleep deprived. It can be related to genetics. Stress, fever, or alcohol can also play a role. What can you do? Keeping a consistent sleep schedule helps. Reducing alcohol use can decrease episodes. If you sleepwalk often, it is important to make your environment safe. Remove dangerous objects, and make sure doors and stairs are secure. Your body goes on autopilot, but your mind is not in the cockpit. Glitch number 9. Bruxism, or teeth grinding. You wake up and your jaw feels sore, tight, or tired. Sometimes you get headaches near your temples. Someone might even tell you they heard grinding sounds while you slept. This is called sleep bruxism, or nighttime teeth grinding. Your jaw muscles clench and grind without your awareness. Why does it happen? Stress and anxiety are common triggers. A misaligned bite can contribute. Certain personality traits and sleep disorders can be tied to it. What can help? Jaw relaxation exercises before bed can reduce tension. Stress management during the day is important. A night guard from a dentist, or even an over-the-counter mouth guard in some cases, can protect your teeth from long-term damage. You might be trying to grind your stress away in your sleep. Glitch number 10. Hypersomnia. You sleep 10, 12, or even 14 hours, but you still wake up exhausted. It feels like you never fully wake up. Your brain stays foggy and slow. This is called hypersomnia. It is more than just being tired. It is like your brain is stuck in low power mode. Even when you sleep a lot, you do not feel restored. Why does it happen? Sometimes it is linked to other sleep disorders, like sleep apnea. It can be related to certain neurological conditions. Some medications can cause excessive sleepiness. What can you do? This is one glitch where you should talk to a doctor or sleep specialist. You may need a sleep study to check for underlying issues. Keeping a consistent wake-up time and getting bright light in the morning can help your body clock. But persistent hypersomnia deserves medical attention. The world might call this lazy. Your brain might simply be malfunctioning. Glitch number 11. Fragmented sleep. You go to bed and sleep 8 hours on the clock, but it feels like you woke up over and over. You never feel like you sunk into deep rest. It is like your night was broken into pieces. This is fragmented sleep. Your body is in bed long enough, but your sleep keeps being interrupted. You are not spending enough time in the deeper, restorative stages of sleep. Why does this happen? Anxiety can wake you up frequently. Alcohol can fragment your sleep, even if it makes you fall asleep faster. Chronic pain can wake you often. Sleep apnea can also cause repeated micro-awakenings you do not remember. What can help? Reducing alcohol, especially late at night, is important. Practicing good sleep, hygiene, and stress management can help. But if your sleep always feels broken, it is worth checking for underlying sleep disorders. You are sleeping in terms of hours, but your brain is not earning any real rest. Glitch number 12. Sleep apnea. You snore loudly. You stop breathing for short moments during the night. Then your brain panics, wakes you up just enough to restart breathing, and you fall back again without remembering it. This can happen dozens or even hundreds of times a night. This is sleep apnea. It is not just snoring. Your airway collapses during sleep, blocking airflow. Your oxygen levels drop. Your brain has to keep rescuing you all night. Why does this happen? It can be linked to weight, to the shape of your airway, to genetics, and to other medical conditions. Why is it serious? Over time, untreated sleep apnea increases the risk of high blood pressure, heart disease, and cognitive problems. It is one of the most dangerous sleep glitches. What can you do? If you snore loudly and always wake up tired, get evaluated by a doctor or sleep clinic. There are treatments like CPAP machines and other options that help keep your airway open. Avoiding heavy alcohol before bed can also help. Your brain is not trying to ruin your sleep. It is trying to keep you alive. Now, out of all of these glitches, here are 3 you should never ignore. Number 3, fragmented sleep. If you are always sleeping in short, broken segments, your body and brain never fully recharge. Number 2, hypersomnia. If you are constantly oversleeping and still exhausted, that is a sign something deeper may be wrong. Number 1, sleep apnea. Because it silently stresses your heart and brain every single night. If you want a part 2 about rare sleep glitches that even many doctors do not see often, comment the word glitch. And if you are watching this at 2 or 3 in the morning, take this as your sign. Turn this off. Put your phone down. Your brain deserves a clean restart. Sleep well,